Hello everyone, myself Swati.S Ummagol from the College of Agriculture, Vijaypura. Today I will discuss about TENOSYNOVITIS. Before going to that TENOSYNOVITIS, first we have to know about the tendons and the ligaments. First of all, tendon. Tendon, it is the flexible connective tissue that usually connects muscle to bone. Then tendon sheath. It is the layer of the membrane that surrounds the tendon. Then the tendon sheath has two layers. First one is the synovial layer, then the fibrous layer. Then in this picture we can see the ligament. Ligament, it is also the connective tissue which connects the bone to bone. This fibrous membrane we can see here, and synovial membrane also. And this cavity is filled with the synovial fluid which is essential to lubricate the tendon. And tendon also we can see here. Then what exactly the tenosynovitis is? The tenosynovitis is an inflammation of the synovium surrounding the tendon, typically leading to joint pain, swelling, and stiffness. A tendon is a type of the fibrous tissue that connects the muscle to bone. A protective sheath known as the synovium covers the tendon. This sheath produces the synovial fluid which keeps the tendon lubricated. Injury to the tendon may result in the malfunction of the sheath. If this occurs, the sheath may fail to make a synovial fluid or may not make enough fluid. This can cause the inflammation or the swelling of the sheath. This condition is known as tendon sheath inflammation and also sometimes called tenosynovitis. Then the types of tenosynovitis. First one is idiopathic, second acute, and then chronic, and then septic, which is most infectious. Idiopathic synovitis. It is a synovial distension of the tendon sheath in young animals in which the cause is uncertain. Then acute and the chronic types of tenosynovitis. These are due to the trauma. Tenosynovitis is often caused by the lesions in the tendon within affected tendon sheath. Then last one is a septic tenosynovitis. This may be associated with the penetrating wounds, local extension of the infection. We can see here the septic tenosynovitis of the distal flexor tendon sheath is one of the most prevalent infection of the deeper structure of the distal limb of the cattle. We can see here the distal tendon sheath, tarsal tendon sheath, and their inflammation. Causes: puncture wounds, purulent claw disorders penetrating into the tendon sheath. Then symptoms we can see here: the unilateral swelling of the heel approximately 8 to 10 cm proximal to the dew claw. Then in some cases the upward tilting of the tip of the claw. We can see here the tilting of the tip of the claw. Then the diagnosis. Septic tenosynovitis of the distal flexor tendon sheath is best diagnosed by the clinical and orthopedic examination as well as ultrasonographic examination using 5 to 7.5 MHz linear probe. Additionally, the synovial space may be punctured to examine the synovial fluid macroscopically and to collect the material for bacterial culture and the sensitivity. Then treatment. In the idiopathic cases of the tenosynovitis, no treatment is initially recommended. Acute cases with the clinical signs may be treated symptomatically with the bandages, cold packs, and the rest. Then when the lesions in the tendons are identified, extracorporeal shock wave therapy may be beneficial, which is more likely to be carried out in horses. Then more chronic tenosynovitis in which the lameness is observed may respond local lesion injections of corticoids and into the tendon and the tendon sheath. Thank you.